Namaste. It is a common belief that Ayurveda is counted as lack of evidence based. So it is not evidence based medicine. This is how it is considered to be, and for this reason, it is commonly propagated that Ayurveda requires to generate evidences for substantiating its effectiveness. So people do not know much. The people who are listening to this or reading this kind of news may not be knowing about the real facts about evidence-based medicine. And this video is intended to educate public regarding what is evidence-based medicine and what the relevance of it in practice of medicine. So the very first thing is that evidence-based medicine, which means that the evidence there is an evidence for that medical system. And what is the evidence required to be for medicine? In medicine, the evidence is required to be for healing, right? If we want to ensure that the treatment that we receive is scientifically proven or evidence based, what do we expect from such a kind of practice? We expect that the particular treatment is proven to heal the patient. So that is the expectation from the patient side. But this evidence-based medicine in Western medicine is just means that the particular kind of drug or the particular kind of intervention is generating more benefit and less risk in a given population. So always an unknown drug or a partially known drug is tested in a population. It's not individual to individual research. What is currently accepted as the best golden standard in modern medical research, that is randomized control trial. So it is blindly administered to a population, and neither the researcher nor the patient is aware of what is getting administered to them, and it is being tried in a large number of people in the same period, and the results are evaluated for benefits and risk. How much benefit outweigh the risk? And the compounds which are given are not intended to heal the subject. Healing means what? Healing is not producing benefit risk. Healing means reversing the disease or reversing the cause mechanisms of the disease and restabilizing the internal environment of the patient. Healing is required for the patient. A patient may have multiple diseases. So healing a patient means all the multiple pathologies in the patient is resolved and the patient is back to health. So healing will facilitate health. But the Western medical research, the drugs or treatments are oriented not with the concept of healing the subject. It is emerged with the concept of blocking, masking, suppressing or supplementing enzymes, pathways, hormones, chemicals in the body, artificially supplementing those chemicals which are lacking in the body by several mechanisms. So it is just making some benefit risk. Definitely when we try to make a benefit artificially, for example, in the case of pain, we are trying to block the pain pathway, whereas the cause mechanisms of pain might be still there, and pain is an immune response. So when we are trying to suppress the immune system, pain will not be experienced, but inflammation can be still there. Or when you try to block the inflammation, for some time the inflammation is reduced, but it can come back immediately after the drug effect. So such kind of blocking, masking, suppressing, altering, substituting, supplementing, etc. are the mode of functioning of the Western medicine. So the research is ultimately targeted to analyze benefit risk and not the healing of the patient. So there can be multiple kinds of pathologies in the subject for which multiple drugs may be required to study for blocking, masking, etc. So the overall impact of them, there is no research to evaluate, to closely and constantly monitor and evaluate what is happening in the particular individual subject after introducing multiple proven drugs by research for benefit risk. So as I told, every drug which will artificially produce some benefit will definitely produce some risk also. Nobody is sure who will get more benefit and less risk. But in the population, it is studied. So, a drug which is approved for more benefit and less risk in a population is what is approved as a drug intended for treatment by the research evidence. That is what is considered as the best treatment by Western medicine. This is one component. So now you will be knowing that this particular kind of newly emerged drug has no certainty that it will heal you. Not only that, it has no certainty to heal you, but also there is certainty that in that matter there is certainty that you are prone to develop any sort of risk and complications to the same in any period of time. And the second component of evidence-based medicine is physician expertise. How much experience the physician is and how much skills the physician has acquired in his practice. So this is poorly standardized. We cannot standardize the physician knowledge and skills. How the physician, that is entirely dependent on how much dedicated the physician is throughout in his learning process and throughout his medical practice, how much he is dedicated in healing every individual patient. Healing as of whole, it is something which is nearly impossible in Western medicine. But how much, that is why the motto of Western medicine is do no harm and not heal the patient. So do no harm is also practically impossible. As I told you, every drug which has got benefit has got risk also. So a practically skillful physician must try to balance the benefit risk in his patient. The patient who is sitting in front of him, how he is able to effectively balance the benefit and risk. Depending on that, the outcome of drug will be in the patient. So that is what is called the skills, knowledge and skills of the physician. Definitely, if the physician is very much dedicated in counting benefit risk, and if the physician is compassionate, definitely he will try to minimize the harm produced in his patient. So that is one second component of the evidence triad of the evidence-based medicine of Western medicine. And the third component is patient concerns and values. So when the patient is coming, from which environment, what kind of environment he's coming, his cultural values, his financial conditions, and his expectations, and his interest. Like if he is coming to a doctor, he will be having certain expectations. For example, if a patient is coming with joint pain, he wants to get rid of the pain. So the physician is asking whether you want to be given painkillers, or you are going for some external therapies like physiotherapy, or you are going to wait and watch whether the pain is resolving on its own. Like that, different options, or whether the patient is directly wishing for knee replacement surgery. So physician is giving the current picture. Now this condition is there, this condition is there. I just gave an example of pain, but in every condition, the physician is, it is important that the physician has to involve the patient in his decision making. That is what is called shared decision making. What the patient is expecting. As a patient, you just think, when you are approaching a doctor, what do you expect from the doctor? Nothing other than healing, right? You want to heal your disease at the earliest and get back to your routine. But by this method, as there is no option for healing, the doctor will ask you this method has this much cost, this much benefits, this much risk. I don't know how many honest doctors will reveal risk to you, but still they are supposed to reveal it side by side. And then you are made into, you are also involved in their decision making process. The patient, as a patient, you can decide whether you want painkillers or you want physiotherapy or you want something else. You want immune suppressants, or you can, which are more seriously harmful, like corticosteroids, or you are ready to go with some painkillers, or which are equally risky, which but as a physician, he has to finally reach a conclusion by involving you. So anyway, finally, it is meant to make you, give you some benefits, and it is not intended, no way intended to heal you, except for certain flu or something, where the immune system will enable you to heal yourself in a time period. Other than that, all the drugs, all the so-called drugs and interventions are intended to produce some benefits for you, outweighing the risk, which the physician has to find out judiciously, compassionately, and apply in you. This is what is called evidence-based medicine in modern medicine. People think that these medicines which are emerging in markets, I won't call it medicine, because in our system of Ayurveda, medicine is defined as something which is intended for healing the patient. So as per the definition, the scientific definition in Ayurveda, the technical terminology of evidence-based medicine in modern medicine is not correct. It is incorrect. Why? Because medicine in modern medicine is intended to produce more benefits and less risk based on probability and uncertainty. Nobody knows who will get more and who will get less, because the study is done in a population and the physician has to outweigh. I mean, he has to do a balancing, like of judicious way of integrating research evidence into his individual patient. And finally, he has to reach a judgment by involving you in the process. So ultimately, these are the outcomes of evidence-based medicine in modern medicine. Now coming to Ayurveda. Ayurveda is such a science which is intended to heal the patient. In Ayurveda, there is nothing called blocking, masking, suppressing, altering immune system, enzymes, pathways, hormones, etc. Ayurveda advocates a scientific healing method where multi-tangled all the different pathologies existing in the patient or active in the individual patient is to be counted in the healing process. And when a patient is approaching Ayurveda to heal one disease, scientific Ayurveda advocates to heal the patient. The patient might be already having multiple other ailments. So a physician, a scientific practitioner of Ayurveda has to integrate, has to understand, study the interconnectivity between different pathologies. Sometimes one pathology might have led to the second one, and it might be running in a series, because nothing is done to reverse the initiating pathology. Sometimes it could have been different pathologies, but everything might have been mismanaged and everything might have been coexisting. Anyway, there are different targets in the body where these underlying pathologies remain connected to each other, or where they require proper attention, prompt attention and reversal, which is entirely dependent on unique patient environment. That particular patient, even though patients are multiple in number, when you are analyzing something to heal a patient, that particular patient environment is to be studied so deeply. The history of the diseases, the way of management of the existing diseases and former diseases, and everything, the impact of the same, matter a lot in the clinical decision making of a scientific practitioner of Ayurveda. So he has to do such a hard work in science-based medicine. Science here refers to Ayurvedic science. Ayurveda is a logical science, deterministic science. Here we are not starting to think from a medicine. We are not starting to think from an unknown compound or an unknown intervention. We are starting to think from logics, principles which are already established in Ayurveda, the theorems, laws, and principles which enable us to understand the patient, the pathology, and the nature of cause and course of the decision that we make. There are scientific algorithms explained in Ayurvedic science to understand a human being as long as human being remain as human being. So we have to apply those algorithms, those diagnostic and treatment principles in the patient, and we have to understand the patient on the whole. Patient means he is a human being. He has got multiple diseases sometimes. He has got unhealed diseases, suppressed, masked, altered, his metabolism, his immune status, his digestive status, his drainage mechanisms, and the alteration, suppression, modification caused by different medications, existing medications, interventions, former medications, interventions, everything has to be considered by us, being scientific practitioners, in our clinical decision making process. So it is not this medicine in that disease suppression. We are applying minimum medication in science-based, evidence-based Ayurveda, which is evidence-based practice of Ayurveda. We are applying 1 or 2 medications to heal the patient. Maximum 1 or 2 medications. We are not going to do any trial and error. We are not giving an unknown compound. We are not giving a compound which is tested in population for benefit risk, observations of benefit risk. Today, if a patient has got a benefit, tomorrow he can get risk also in such studies. So such kind of aimless, probability based, randomized, blinded control trials are considered to be unscientific in Ayurveda. We have to study the unique patient environment, understand the patient on the whole, understand the pathology so deeply and promptly, understand, connect the patient living, patient unique environment with emergence of his disease, cause mechanisms, and we have to reverse the cause mechanisms of the disease and heal the patient. Once we are doing this, the results are so fast. It's not like trial and error. We have to wait for some time, days, weeks. It's not like that. When we are applying the right principle, the results will begin from the first day. If we are applying the wrong principle, it can be wrong. Adverse results are observed on the first day. So it is really important for a scientific Ayurveda practitioner to follow up the patient accurately, precisely, so that amendment of decision can be done within the first 3 days and confirm that the physician is in the right direction along with the patient. So once this is done, healing is beginning. And in acute diseases, we can achieve that, we can accomplish healing in not more than 10 days. And in chronic diseases, not more than 1 month. So this is what SBEBA is doing, science-based, evidence-based Ayurveda, which is very much different from the conventional Ayurveda practices. You know the difference. When you are going to Ayurveda practitioners, you are prescribed multiple medications. Sometimes you will be asked to continue them with modern medicine. Unfortunately, this is a very big uncertainty kind of trial you are giving to your own body, because both the systems are working in different ways. As I told you, modern medicine is trying to do adjustment, whereas Ayurvedic medications, which are intended to do treatment, can cause the result based on the method in which, the logic based on which it is chosen and applied. If your particular Ayurveda physician has chosen wrong medicines or wrong treatment approach, and if he is trying to mix with Western medicine, there is no guarantee that you are receiving scientific Ayurveda medicine. It is certain that you are not. And the results which you are getting cannot be counted as the outcome of Ayurvedic treatment, because it is an outcome of ignorance of your Ayurveda physician. So in the conventional scenario, as there is no evidence-based practice in Ayurveda apart from SBEBA. In SBEBA, we are practicing science-based, Ayurvedic science-based, evidence-based medicine, where we ensure that our clinical decisions are very much protecting you and maximally intended to heal you in our every step of action. In every course of action, we make sure that you are getting healed and you are getting protected. So it's not that we can heal you, we can heal you, we cannot assure, because that is entirely dependent on your nature of disease, how much complex it is, whether it is you are responding to our medication and treatment, etc. So many other factors. But our objective is healing. We are not doing anything adverse to healing process. That is assured by SBEBA. If you are going to a quality SBEBA practitioner. Now, how can you assess whether you are going to a quality SBEBA practitioner? First, you can understand from the doctor what he is doing and what his expectations are from his prescriptions upon you. And second, he will make you understand your crucial role in your recovery process. How much fast you are recovering, you can observe whether you are going in accordance to your expectations. If there is something which is hindering in between, you should immediately check back with the doctor in person. It's not possible online most of the times, because minutest thing what you are doing in your recovery process can impact your recovery. So the doctor can understand that only from a direct meeting. Finally, you are protected in the everyday, and you can share all your concerns of healing with the doctor, and doctor is taking a real SBBA doctor will be taking responsibility of you, along with you yourself taking responsibility of your healing. Thank you.